My name is Mike Gunderson. I live in rural Davis, Illinois. I'm a husband, an audiovisual professional, an avid motorcyclist, and a dog lover. I spend a lot of free time with my wife and my family. Those are very important to me. I also enjoy riding the motorcycle, which unfortunately I haven't been able to do the last couple of years, but I'm starting to get back on that again. Back in 2012, I had some abnormalities in my healthcare that we couldn't really figure out what was happening. I had some random joint swelling, chronic sinus infections. I had lesions on my skin. It looked like an allergy. Just a very, very hard symptoms to diagnose. So I took a day off, and later that day I remember calling my wife at work and saying that you really need to go to the ER because I'm starting to cough up some flecks of blood. And we agreed to go out of network and go to the Monroe Clinic emergency room, where we were met immediately at the door, and my case was taken very seriously, very fast. Turns out I spent 10 days in the hospital, 9 nights in the brand new hospital that had just opened. And I had a healthcare team sitting around my hospital bed at one point. I think there were about 7 of them, and it felt like a university hospital, telling me what they were going to do with my case and what the next steps were. And the next step was an invasive lung biopsy surgery. The day that we had a meeting in the hospital with all the physicians, I had the Dr. Netzel, the pulmonologist, I had Dr. Rickers, the surgeon, and I had Dr. Davidson, and I had Kate Kinney, the hospitalist, and I think the 2 nurses that were on duty that day for that wing, all sitting in my room. So it was kind of this awe-inspiring group of people that were talking about what they were going to do. And I never forget when Dr. Rickers told me, so I'm going to take a fairly healthy guy and put him in some pain. And you were right, Dr. Rickers. You did. It has subsided. This day, I still, if I have a bad sneeze, I still do feel a tingle in my ribs where the chest tube was for 6.5 days. But I really felt like I was in a great place, surrounded by good people that really wanted to help me get well. The previous set of physicians, about 5 of them that I was dealing with from another network, were all treating just the symptoms of the disease. The rheumatologist was treating the rheumatology-related diseases. The ENT was treating the nasal and sinus. My general practitioner was treating, a lot of the diseases. An allergist was treating the lesions on the skin. The problem was they weren't combining their notes. They were all telling me I wasn't sick enough to have this Wegener's or GPA disease. The Vasculitis Association has what they call the VF Red Award, which is for the outstanding diagnosis of vasculitis-related diseases. It's a patient-nominated award that I nominated Kate Kinney, the hospitalist, for her outstanding work in getting that team of people in my room to figure out what I had and to make the diagnosis. Well, we found out a few weeks later after the nomination that Kate had actually won an honorable mention to the award. She was 2 votes off of first place. They couldn't discount that out of the 30+ nominations. So Kate actually won the award. To give Kate that award was an amazing experience to me. Without the team of people that have taken over my healthcare, I wouldn't be working. I probably wouldn't be riding the motorcycle. I wouldn't be doing my own yard work. So the Monroe Clinic really gave me my life back. It's been an amazing experience from day one. I've met and talked with some of the leading vasculitis doctors and researchers in this country at a symposium. And I would say my healthcare team at the Monroe Clinic is outstanding. My name is Mike Gunderson. I have vasculitis, and this is my Monroe Clinic story.